In this presentation, I will talk about the impression taking step-by-step procedure for a prepared tooth to receive a restoration. Guys, first of all, you should know that the scanning intraoral cameras that are newly developed are the best option to do that. They are very effective and they are becoming very cost effective too. So that you should put this into your consideration before taking any use of the usually used impression taking procedures. Okay, then we will start our impression taking procedure by a quick history taking and exam for the patient's dentition. Then do anesthesia for the intended tooth and the surrounding gingiva. If it has an endodontic treatment, just anesthetize the gingiva, and then after that you should remove the temporary crown or the provisional restoration that you have put after the preparation procedure with the use of the hemostat, and remove the excess luting material, the provisional luting material, which is mostly the zinc oxide iogenol cement, and so that now you will have a clean tooth to receive a restoration, an impression. After that, use a stock tray and silicone heavy body to take the primary impression. And that is, guys, by taking a piece of the heavy body and rolling it into a cylinder and then putting it in the special tray, in the stock tray, and then taking the primary impression. After that, you will have the special tray. This primary impression will act like a special tray. After doing that, we should do the retraction procedure for the gingiva, and that is to allow for a better visualization of the margins and finishing lines, and to allow for the proper impression taking procedure and recording procedure for that margin and finishing line. And that is done by the use of something called as a retraction cord. This retraction cord must be dipped in a topical hemostatic agent. For example, aluminum chloride, as you can see in the picture below. This is not the one that we use in dentistry, but I want you to read the aluminum chloride sentence so that you will remember the type of the topical hemostatic agents that we use in dentistry with the impression taking procedure. So that after dipping the retraction cord that has been cut in a proper length in the aluminum chloride or any other topical hemostatic agent, then we should push it into the sulcus by the use of a plastic instrument or a cord packing instrument. When we pack the retraction cord in its place, we should start with the easiest place, and that is, of course, the place with the most retention of the cord, which is the interproximal areas and spots. After pushing the retraction cord into the interproximal areas, we should push it upwards and outwards for the upper teeth, and we should push it downwards and outwards in the lower teeth preparations, and go anteriorly and then posteriorly until we encircle the whole tooth preparation. Okay, after that we should leave it for 10 minutes in place to give its effect, and the topical hemostatic agent will not only lead to no bleeding in that area, but it will also lead to a transient ischemic situation in that area, which will lead a contraction in that area, making the visualization and recording of the margins way much easier and more accurate. After that, we extrude the silicone light body and start again from the margins and continue extruding the light body around all the margins of the preparations. In these situations, guys, I want you to put the tip head inside the impression material. As you can see in this picture, the tip head is inside the impression material itself, and that is to prevent the occurrence of bubbles. Okay, then continue the extrusion procedure until you cover all the tooth. As you can see here in this picture, we have completed the extrusion procedure until we have covered all the tooth preparation, and then we finish our extrusion on the adjacent tooth, and that is again to prevent the occurrence of voids and bubbles. After that, we bring the special tray that we have already prepared and done and push it backwards anteriorly, from backwards anteriorly, with a slow and steady pressure, and then ask the patient to bite for a specific amount of minutes, and it is almost 4 minutes, but to be more precise, we should use the manufacturer's instructions and know how many minutes we should keep the impression inside the patient's mouth for the proper manipulation and to have the best results of the impression. After that, we should remove the impression by one rapid movement, and that is to avoid tearing of the impression. After that, we should examine the impression, the margins, the margin geometry, and the finishing line should have a well-defined and smooth shape without no voids, without no bubbles, no tears, no anything. The margins, or as we call it, the finishing lines, should be very smooth and well defined, because this is the place that the crown will be put on, and as we have said in the principles of tooth preparation, should be as smooth as possible to make the following steps easier and to make the restoration more successful. After that, we take an alternate impression for the opposing arch, and that is for the occlusion purposes. If the occlusion cannot be put by hand between the two arches, we should take a bite registration record by using, for example, wax bite registration record material, or any other material that records the bite between the two opposing arches. After that, we cement the temporary crown again, take shade, disinfect the impressions, and send them to the lab. Guys, I want to indicate here and concentrate here too that you should always read the manufacturer's instructions, and that is for the best manipulation of the material and to have the best results that you would ever wish to have. And also you can watch the videos of for example the channel Dance Supply Sirona, because they always give you an explanation about the materials that they produce and develop, and that is that acts like the manufacturer's instructions but in a tutorial or a video shape, so that you should read the manufacturer's instructions and watch the videos of the manufacturers if they have made some videos regarding their materials, and then you will have the best manipulation and best results you would ever wish to have. Thank you for improving yourself by listening to this presentation. Always try to know, always try to spread knowledge and construct the world. Be kind to one another, and that is for the greatest benefit to the humankind.